I watched Professor Jim McMenamin give evidence on behalf of Public Health Scotland to the UK inquiry on the 29th of May 2025. I note that he made several claims within his evidence that were not factually correct, and I believe he has used statistical interpretation to mislead the inquiry. First of all, McMenamin makes the claim that the public health interventions, including the COVID-19 vaccines, reduced the number of deaths from COVID-19 in Scotland. Even using Public Health Scotland's own data, that claim is not accurate. Scotland had suffered no excess deaths in early 2020, when COVID-19 was said to be circulating unchecked. By the time of the national lockdown on the 23rd of March 2020, Scotland had actually recorded negative levels of excess deaths, seen below in yellow on the chart. The spike in excess deaths only started after the lockdown was implemented, with death rates in care homes doubling during April 2020 whilst under lockdown restrictions. Since the lockdown, Scotland has suffered over 28,000 excess deaths. This represents a 10% increase on the pre-pandemic average.
And one thing that often does get missed is, I don't know if anyone has offered on behalf of the NHS in Scotland the profound thanks that we have to the whole of the Scottish population. They were, throughout all of the time, compliant, and as we've gone through today, really, it was entirely due to their self-isolation and the adherence that they had to the Test and Protect programme, that it bought us time to develop, deploy and demonstrate beyond doubt what we then went on to see, the effectiveness of the vaccines that were available to reduce mortality and bring us back out of that restrictive set of things that we implemented for societal response.
Professor McMenamin makes the claim that the COVID-19 vaccines reduced the number of COVID deaths in Scotland. From Public Health Scotland's own data, we know that Scotland had reported 5,000 COVID deaths before the vaccine rollout, yet we suffered a further 10,000 COVID deaths after the vaccine rollout. The majority of those 10,000 deaths were amongst the vaccinated. Public Health Scotland confirmed this at the time in their weekly reports titled COVID-19 and Winter Statistical Report. This report would cease publication in February 22, after it became clear that over 90% of the COVID deaths being reported were actually amongst the vaccinated, making McMenamin's claim about the vaccine efficacy a false statement. This data is all confirmed by Public Health Scotland themselves and National Records of Scotland. National COVID testing would also stop in spring 2022. And then obviously the number of cases being reported seemed to fall. But was this just a result of the tests having been stopped? The number of excess deaths being recorded in Scotland continued to rise through 2022 and 2023. Something else was killing Scots in excess after the pandemic had been declared over. The inquiry should be investigating the root cause of these excess deaths. Professor McMenamin also made the misleading statement that there was no correlation between the discharging of 5,000 hospital patients into Scottish care homes and the subsequent spike in excess deaths in our care homes. No amount of statistical trickery can hide the facts shown in the table below. During the 10 weeks of national lockdown, there were 2,478 excess deaths in Scottish care homes, an 84% increase over just 10 weeks. Then, after lockdown ended, care home deaths returned to normal levels and actually went below average over summer 2020, as you see here in the green bars. There is clearly a causal link here between the implications of lockdown and treatment protocols and the spike in all-cause excess death mortality we saw in our care homes during the lockdown from March 2020 to the end of May 2020, where deaths almost doubled in our care homes. During the cross-examination of Professor McMenamin, the Inquiry Council raised concerns with the findings of Public Health Scotland's report on discharges from NHS Scotland hospitals into care homes between 1st of March and the 31st of May 2020, the report confirmed that there were 5,198 discharges, 4,804 individuals, from hospitals into care homes. A subsequent Freedom of Information response from Public Health Scotland confirmed that of those 4,804 patients discharged, 1,159 of them died in the care home they were discharged into that summer between 1st of March and the 30th of June 2020. If those patients were deemed fit enough for discharge, why did so many of them die? 675 of them died within 30 days of discharge. Public Health Scotland Act is a Scottish government agency. Their own report claims there was no correlation. This is Public Health Scotland marking their own homework here, misleading the public and the inquiry with a false claim that there was no statistical correlation between hospital discharge and increase in deaths in care homes. Scotland and the rest of the UK continues to suffer elevated levels of mortality post-pandemic. Why? Why after a pandemic, when we lost 250,000 of our most vulnerable members of the population, do we continue to see elevated levels of death, and most worryingly, elevated death rates amongst the younger age groups? The Office for National Statistics and National Records of Scotland became so concerned with the elevated levels of excess death that in February 2024 they changed the methodology for calculating and reporting excess deaths. The previous 5-year average method, based off actual death figures in previous 5 years, was replaced by a statistical model of expected deaths. This new methodology raised the mortality baseline by over 10%, and in doing so now hides the elevated mortality levels. Death rates should have fallen after the pandemic. Instead, they have remained elevated above the pre-pandemic average. No amount of obfuscation or statistical tricks can hide that fact. Thanks for watching. Please share.